Good morning, Kalamazoo. Good morning, everyone. So this is Stephanie Moore. I'm happy to be with you all here this morning on behalf of Mothers of Hope. I want to talk to everyone about a partnership that we have with the Family Health Center. The Family Health Center, in a major, humongous way, is coming very strong in the Kalamazoo community to help make sure we have access to the vaccine. We want to protect everyone. We want to preserve life, but most importantly, we want you to live, to thrive, to be healthy. I have a couple guests with me today. But before we get started, I want to see if I can share some information with all of you. Make sure you are liking, sharing, streaming.
My name is Dr. Cheryl Dixon. I'm a pediatrician and I'm also the Associate Dean for Health Equity and Community Affairs at the medical school here in Kalamazoo, Western Michigan Medical School. I'm also a board member for Mothers of Hope, and I'm here with pharmacy, advanced pharmacy. Was able to get funding through the state to get vaccines, to actually give vaccines in the community where it's needed. So the zip codes of areas where people are most impacted, the vaccines are actually, we're going to be doing pop-up clinics. The reason why we're here today is with Mothers of Hope, is to actually make sure that we are giving the vaccines, explaining about the vaccines, for the people in this community who actually have been most impacted really by COVID-19 infection. So having the vaccine actually will help prevent them from getting sick and from dying and from actually having complications that we know that virus can cause. So I'm really excited that we were actually able to partner with Advantage Pharmacy and Mothers of Hope to be able to extend this to the community.
So we are honored to be out here with Mothers of Hope today, making sure the entire community is vaccinated. As you know, we are all fighting this pandemic with COVID-19, and we are so honored that we have the vaccination right here in our community. Family Health Center is proud to be a collaborator where we can come out with Mothers of Hope and bring our staff members and providers to bring our expertise and helping to ensure that we can work with Advanced Pharmacy and WMed and the Western Michigan University Homer Stryker medical students and get this vaccine out to our community members. We are all in this together and we are much stronger together.
I'm one of the founders of Mothers of Hope, and we just want to thank you for your support and for the opportunity to be able to bring the vaccine to the neighborhood and to help people and get them vaccinated. We want to thank everybody that has contributed in one form or another to make this day happen, all the volunteers. And I'll tell you a little bit about Mothers of Hope. We were founded over 20 years ago. We started out as a group of women in recovery that wanted to give back. And we wanted to do things in the community that was about substance abuse and recovery. And so we ended up at this point over here at our facility, Mothers of Hope headquarters. We continue to do stuff about recovery, but we also continue to do stuff about different things that's needed for the community.
Hello, my name is Dolores, and I'm also a founder of Mothers of Hope. And we just want to thank all of you in the community that support the community. You know, we ran this community in the streets of this community for years. Now it's time to give back to the community and help those that are still out here. We're all about recovery. We're for recovery. If you want help with recovery, we're here.
It was quick, easy, and well organized and painless. But they said it's gonna give me a sucker if I didn't cry, and somebody didn't get my sucker yet.
And you didn't get a sticker either. What's up to the place? But we're thankful.
It was wonderful. Great service to the community. Again, it was quick, easy, and well organized.
Way to go, Mothers of Hope.
All right.
So, good morning, everyone. We are here today. It is my honor and esteemed privilege to introduce to you the president, CEO, Denise Crawford of the Family Health Center here in Kalamazoo. And it's because of her leadership, her dynamic team of the Family Health Center family that comes together and actually brings medicine, health access, health opportunities, and wellness to the Kalamazoo community and the surrounding areas. So I want to first welcome Denise here. And Denise, I just want to do a quick check-in with you. How are you and the Family Health Center team? And what do you have coming up here soon?
Excellent. Thank you, Stephanie. Always honored to talk with you and meet with you. And we are so excited to partner now with the Mothers of Hope as we continue to work and really, just do all that we can to stop out this pandemic. So we are now partnering and really doing what we refer to as taking it to the streets. Lots and lots of activity centered around really reaching the people where they are. We want to partner with our community members. We want to ensure that everyone has equal access to this vaccine. As we know, COVID-19 has been astronomical. We all have been fighting this pandemic. We know that the best remedy that we have right now is the vaccine. And so Family Health Center has, fortunately, we have access to the vaccine. We have numerous doses of the vaccine. We have a wonderful partnership with Bronson Hospital, with the County Health Department, with Borges Hospital. And so we're all coming together, and Family Health Center is taking on the helm of actually coming directly to neighborhoods with our mobile clinics and bringing the vaccine to individuals. We know that there is no better partner to do this with other than Mothers of Hope. And so we are coming directly to the neighborhoods.
So Denise, we want to take just a couple of minutes just to talk to the individuals about how important this opportunity really is. So we want to give them some medical information about this vaccine, what it does, and why is it important for the community. So we have with us today Dr. Khouli, your CMO there at the Family Health Center. Why don't you give them a proper introduction, Denise?
Absolutely. So this is Dr. Wael Khouli. He is our interim chief medical officer at the Family Health Center. And we know sometimes we just like to keep it real and not be so technical. So in just layman's terms, what that means is that he is over every single physician at the Family Health Center. He is responsible for all of the clinical health care that takes place at Family Health Center. We are so pleased with Dr. Khouli. He has been with us for the past 3 months. He stepped in and did a lot of phenomenal work to get things started, and particularly centered around COVID-19 and the distribution of this vaccine. He actually came in right when we were receiving the vaccine, and so he was instrumental in assisting us in getting the vaccine out. I will also indicate that this is Dr. Khouli's last week with us, and so now he's doing a fine job at training our new permanent chief medical officer, who you'll have the opportunity to meet later, Kalamazoo community, Dr. Watley. And so he's now transitioning the reins to Dr. Watley. But again, Dr. Khouli is with us. He's been instrumental. He's led all of the effort. And so we definitely want him with us here today. So Dr. Khouli, please welcome.
Dr. Khouli, unmute your mic. There you go.
Thank you. Sorry for that. A huge thank you, Denise, for this really nice introduction. Thank you, Stephanie, for allowing me to partner with you on our Mother of Hope, for allowing Family Health Center to be part of this partnership, so that we are doing everything we can to keep our community here healthy. And there is no higher priority in the current times for us, other than anything higher priority than vaccination in our current times right now. So everything that we could do right now to make vaccination as accessible, as easy as possible to our community, and make sure that any concerns, any hesitation that's in the community around being vaccinated, that we're able to address that, and they have the confidence in the Family Health Center, have a confidence in this system here, that we're doing our best to protect the community from a virus that could be seriously deadly for for the community here, and a virus that has impacted heavily in a negative manner. So this is our a chance here to partner with leaders in the community like yourself, Stephanie, and your team, so that we are able to make it as convenient as possible for anyone in the community, for everyone in the community to get vaccinated. So it is my honor, truly my honor, to be part of this.
Awesome. So Denise, Family Health Center has been on the ground since day one, since this pandemic started a year ago. You have been giving information, empowering our residents, and also vaccinating those. Talk about what you and Dr. Khouli have learned through this process, and why is this just so important?
Absolutely. So, we know our focus has always been, since the inception, as we celebrate our 50-year anniversary this year, Family Health Center has always been about the community. We purposely, ensure that we are placed in the heart of the community, and we want to make sure that the community has access to needed primary care. So as this pandemic was coming down the pipe, we knew that it was going to be critical that we get the information out to our members as quickly as possible, and to anyone that needed access, but particularly those individuals that typically are not always at the forefront, are not always in the know, if you will. Individuals that we would consider to be, as I very comfortably say, our babies, making sure that our babies are covered, and the parents of our babies, and our seniors are covered, etc. And so with COVID-19, as you know, information was coming way back in March when we had some of our first cases. Information was coming so quickly and changing so rapidly that we, as the healthcare organizations, we were just getting our arms around it. This was brand new, keep in mind. And so we did not know a whole lot about this. We really didn't know anything. And so we began, as we were learning information, it became critical that we switched our operations, and we constantly began to flood the community through your network. So again, I'm very thankful to you, Stephanie, Mothers of Hope, but through Facebook, through any type of social media, getting that information out. Also, we began to learn very quickly, and unfortunately, that this virus was really attacking those with Black and brown skin. And so we wanted to make sure that people had the information where they could protect themselves and they could protect their loved ones. We then lifted up the testing so that again, we could let people know this is what's happening, this is what you need to do, this is how you quarantine, this is what needs to take place. Keeping patients top of mind again. And as that information, and we know it was a very challenging time, and people would get very confused because oftentimes that information and that data would change 2 to 3 times a day, because that was just how fast the information was coming and the data was coming. And we were clued into the, the state level and the federal level and the MDHHS and the CDC and the WHO. And so everyone was just, really trying to keep us at the highest level of information and knowledge transfer. And then the beauty came and a vaccine became available, and it was tested and it was approved. And once the CDC announced emergency use authorization, we were able, again, by our wonderful partners at Bronson Hospital, to get access to this vaccine and get it out to the individuals, of course, first being our seniors. And in no short order, you were there for us again, Stephanie. And we remember it was a very cold, snowy day in April, but we were out at Stone's Church. That was not by accident. Our very first vaccine event took place right on the north side, because again, we wanted to make sure that we brought it to the population that we were most concerned with. We wanted to make sure that our patients had access. And so with those being 65 and older, we were there. We vaccinated individuals, and we had over 450, I believe almost 500 individuals who received the vaccine, the Pfizer vaccine, and we haven't stopped. We did the same thing with testing. We were there for the community. We will continue to be there for the community. Again, I cannot urge you enough. This is the best defense that we have. This is a life-saving vehicle. We have seen the effect of this virus. We want you to be safe. We are not just preaching this. We are not being paid to do this. As you know, this vaccine is free. We want to save you. We want to save your lives. We need you to allow us to help you. And so that's why we're out here. We have seen the results of this. We are really, we want to help people stay healthy. We need to protect you. We need you here with us. And so that's truly the purpose of it. It is a life and death situation.
So Dr. Khouli, real quick, in layman's terms, like, why medically do we need this during this pandemic?
So what we learned from the pandemic right now, that it is very difficult to contain the virus. Right from the beginning, it was very obvious that the virus is spreading very quickly at times when patients were not symptomatic and not showing signs of the disease, which made it so difficult to contain the pandemic. We had to go through a lockdown. We had to go through social distancing and measures that we've at a historical level. Basically, it's because of the virus is so easily transmitted, and because it's unpredictable of how serious the illness is going to be. I mean, right now, if we look at what's going on, and we vaccinated the majority of the elderly population, we're seeing that younger population is getting seriously ill as well. And the virus changes by nature, mutations and new variants are popping up, makes it even more difficult to contain it. Luckily is that the research has already started years ago, 17 years ago, actually, to be exact, that paved the way for us to develop a vaccine very quickly. And I could say that most health experts, experts in the medical field were pleasantly surprised to see how effective and how safe the vaccines, are after all the research, all the infrastructure that's available here or internationally were put into developing these vaccines. And now that we know that the vaccines are, extremely effective, and from a safety perspective, knowing that there are hundreds of millions of people have already been vaccinated right now, and we're only seeing a few serious events are happening. So we know that the vaccine is extremely safe if we again look at the scale of the vaccinations that are going on. So it is safe and it is effective, and it's the most powerful tool that we have right now to stop the pandemic, to protect our community, ourselves, our family members, our economy. Truly, is the vaccine, and it's our most important tool that we have for us right now to go back to normalcy. To everybody's getting sick of the pandemic mode that we're in, masking mandates and social distancing, and many of the normal life that we've enjoyed before, we no longer have right now because of the pandemic. Our best way to return back to normalcy will be the vaccination. We will need at least 70% of the population to be vaccinated for us to achieve what we call herd immunity. So for that reason, it's clearly our number one priority, whether you look at it from a public health, from economy, from even a social function, the social structure of the community and the nation. There is no other high priority than the vaccination.
Awesome. And so, Denise, you know that we can't do this work without the people who are grounded in the community. We have with us today my good friend, Eric Cunningham, Kalamazoo City Commissioner, the Honorable Eric Cunningham from the East Side. Hey.
All right.
Eric, I believe you have had your vaccine. Talk to us a little bit about your experience and why you think this is a good thing for the community.
Well, first and foremost, thank you for even having the honor to speak to this issue. Thank you to CEO Crawford for the intentionality around getting these type of initiatives into our community. So, one, I can appreciate Mothers of Hope on multiple different levels. If it wasn't for the individuals in the community reaching out to me saying this is accessible, I'm not sure if my family would, as many of us would be as vaccinated as we are. And to be straightforward and blunt about my own experience, I hate going to the doctor. I will not go to the doctor if I don't have to. Did I lose a leg? Then I can stay home. I'll be all right. I'll figure it out. But my experience just over the past year is I have a father who's recently experienced adult asthma, and so you're talking about something that attacks your respiratory, and so I was intentional about not going around my family, my mother, my father. I haven't hugged my mother in close to a year, and so that type of experience led me as a paranoid Black man on top of that to ensure that I went out and got my vaccination. And there's some other components that plays a role. And, as a leader in this community, we have to use wisdom. And I'll be straightforward and honest. If I was the president, if Eric Cunningham was the president of the United States, this would have rolled out completely differently. Our previous president, he wasn't straightforward and truthful and had a lot of lies and trying to play down the seriousness of what our community was dealing with as it pertained to this virus. And if I was the president, I probably would have did the opposite. I would have came out there and straightforward had a conversation. Hey, look, everybody, this thing, I hear if you breathe it in, you might be gone in 2 days. But because of the laid back approach that the administration took legislatively, you have a lot of individuals with a lot of different thoughts and a lot of different experiences, and a lot of it is rooted in in what the experts say. And that's the thing about society today is we're dealing with a lot of individuals who are selfish, a lot of individuals who are using their own experience and then trying to reflect that upon, deflect that to the community. And reality is, a major reason why I got my shot. And mind you, I've never had the flu shot. I've never had the flu, to my knowledge. And any other vaccine that I don't have to take, I'm probably not going to take. But this was something that affected us as a community, and so reality is, the need is there for us to take care of one another. And when individuals are selfish and only think about yourselves, it makes it hard. And so, as you can tell, in certain communities, it hit harder than others. And a lot of it was just misinformation. I heard things such as African Americans can't catch it. I heard such things as it's not in our community, it's in their community. And even simple things like, I don't have it. Well, how do you know? Well, only people I've been around is with cousin JoJo and sister Ray Ray. And so, when you hear such things or you hear those type of conversations, we still have to use wisdom. And wisdom isn't just our understanding. Wisdom is a collective knowledge. And so when you're hearing, hey, this is dangerous, these are the type of impacts that our community is facing, and you just blatantly ignore it, that causes, stress and strain on a lot of individuals. And so, I've lost friends, I've lost family members, I've lost individuals, extended that I've seen who passed away from this virus. And I think a lot of it was unnecessary. The perception is, oh, well, we're America and we're doing great and we have, top of the line everything. But in reality, for whatever reason, it hit our culture, our communities, this country harder than it did a lot of other countries. And I think the baseline to it is our culture. There's just a selfishness. And so, like I said, if I was the president of the United States, I would have shut everything down. A few would have ruined it for the majority. But what we're really finding is it's not just the few. There's quite a few people who are just taking a lax approach. And for those who still do not want to take the vaccine, I'm not opposed to individuals not taking the vaccine. But what I am opposed to is individuals who don't take the vaccine and don't stay home. Individuals who don't take the vaccine and now they want to come outside, they want to wear, your mask and things of that nature. And that's unacceptable. And so those are the type of things that I just can't support. And those are the type of things that I won't be allowing, for my family to try to say and do. And I appreciate my father. I'm gonna put you on blast, Dad, just because, he made it a priority to call each family member and say, hey, you need to get out here and get this shot. There's opportunity at this time, this place, just sign up. This is how, and even walk some of them through it for them. And those are the type of measures and the things that are needed within the community, is that we all take a role and do a little bit that we can.
Eric, thank you for your honesty and for being so candid about this. This really is a truly important situation. We want to make sure not only that we protect ourselves, but all of our loved ones. So Denise, we're at the point in this broadcast where we're just going to let the folks know why we're really here. We want to invite the community to join us this coming Friday, May 7th, to our vaccine clinic with the Family Health Center. Yay! And Eric, we're going on the East Side. We got to show that love to our East Side neighborhood residents. So we are available for everyone in the community. We are, Denise, intentional about reaching out to residents on our East Side in 49048. We want to make sure that folks have access, have opportunity, have a better chance at protecting themselves and their families. So this Friday, May 7th, from 3 to 6 p.m., we will be out at the 13 and a half Quick Stop store. Everybody knows Happy. Happy is the owner of 13 and a half, and he's hosting us at his store, 806 Riverview Drive. And folks, all you have to do is just sign up. It's really quick. I put the link in the chat there for you. Sign up, schedule your appointment time. If you know someone that does not have access to the internet, the computer, to sign up on the link, that's okay. Walk in, show up. Come see us, push, pull, crawl, drag. We got you. And Denise, We pulling out the barbecue grill.
That's
We
right.
bringing the laundry detergent.
That's
We
right.
got some prepaid cars, Eric, to Stadium Drive Laundry. We got swag bags. I mean, we coming through on the east side. We got nothing but love for our brothers and sisters on the east side. And that's why we're here today, to talk to our folks, to let you know why this is important, to inform you that we are coming, to let you know we bringing you all kind of this and that, but most importantly, Dr. Khouli, we come in with the health access that they need to save and preserve life. So please click that link that I posted in the chat. Like, share this stream, share the link, tell folks to go ahead and get signed up. It will be a walk-in clinic, right, Denise?
That's right.
Or are we
Absolutely.
doing drive up to, or just walk in?
Just walk in.
Just walk in. So there'll be seating. So
Yes.
tell us, Denise, what should they expect once they get there?
So it will be a typical clinic. It's going to be set up specifically for you. It is always safe, and we do all of the social distancing. We're going to make sure that you are absolutely accommodated, as Stephanie indicated. We will have barbecue there for you. We're going to make sure you have swag bags. There's lots of free giveaways. We'll have DJ Chuck there spinning the tunes. We're going to take care of you. It will be a very comfortable experience. A unique experience designed for you in your community, specifically for you. And you'll enjoy it. You'll enjoy it. The vaccination part is very smooth. It will be done by licensed clinicians. They are very respectful. Any questions that you have, any concerns that you have, that's why we're there. We will walk you through the process. There will be no pressure. And we will answer any questions that you have. Take all the time that you need. We are there to cater to you. But most importantly, we want you to feel comfortable, and we want to keep you safe. That is our total goal. We want to keep you safe. We are coming to you. And of course, Mothers of Hope will be there right along with us.
Absolutely. So Commissioner Cunningham, this one is going to be on you. Since you hail from the east side, you got to get out here and you got to help us make sure that we get all of our east side brothers and sisters aware of this vaccine clinic, encourage them to sign up, and we got to get them to the 13 and a half. So you got me?
I got you. And the sad part is, we might have already got plenty of them over to the north side. So, hey, I appreciate the energy, because y'all already got half the battle done.
Well, Commissioner Cunningham, you got to get on the north side and get them back over to the east side then. We need to bring community unity together anyways. We need to cross over, go get our south side brothers and sisters. Hey, we going to the west side. If you are interested in getting your vaccine, especially our young people, we're talking about going back to school, right? We're talking about, kids being in learning hubs, sports are in play right now. Parents want to go out and enjoy and watch and cheer along their young people as they're engaging in positive activities. We got people that are going to work. We have to go to the grocery store, Denise. We want to make sure that these folks are vaccinated just like we are. We want to make sure that when we got to go and start getting ready to buy shoes, I know my son just grew out of everything. I need an extra check for him. So I gotta go and buy shoes, and so we want to make sure that the essential things that we need to do, that we're protected, and the people that are around us as well. So everything's free, right, Denise?
Absolutely. Everything is free.
They just need, if you can, bring your ID. If you have a medical card, bring that with you as well. We're not turning anyone away. We would like for you to have an appointment. If you don't, it's okay. We will take you in the walk-in as well, and we'll make it extremely, extremely comfortable. So please, on the screen, it gives you the date, Friday, May 7th from 3 to 6 p.m. at 13 and a half store, 806 Riverview Drive. And y'all know how happy he is. We got our stuff, but he coming with his stuff too. If you would like to volunteer, please reach out to Mothers of Hope. We would like to have as much hands on deck as we can. If you want to help us walk the neighborhood in these next couple of days, please feel free to join us. We will be on the east side, Eric, going door to door, dropping those flyers off starting this afternoon at 3 o'clock. So if you see us out there in the hood, give us a little love. Yay.
That's right.
But most importantly, if you cannot make it this coming Friday and you need a different appointment, you can always call the Family Health Center. The Family Health Center, you can give them a call and they will make sure that they are taking good care of you. And then again, Denise, we will be back again next Tuesday to talk to the
Absolutely.
residents, because we will be on the north side, Commissioner Cunningham. We will be at Interfaith Homes next Thursday evening, bringing the same energy, vibes, music, food, giveaways right here to all of our friends and families on the north side. So please, if you can, make sure that you're reaching out to the Family Health Center. Make sure that if you don't have internet access and you want an appointment, you want to let us know that you're coming, you can text or call this number here, 269-270-5810. Again, text is always good. I tell everybody the best time to call me is to text me. 269-270-5810. It'll come straight to us. We will get you hooked up. If you have older people, if you have people that don't have a smartphone, texting or whatever, don't worry about it. And lastly, I want to share this with you. Feel free to come. If you need Wi-Fi access, Mothers of Hope have Wi-Fi. If you want to sit there and watch a movie or whatever while you're waiting, which there's not a long wait period. The only wait you'll have is after you receive your vaccine. We will observe you for at least 15 minutes to make sure, Dr. Khouli, that they're okay, no reactions. We will have medical folks on site. Anything, whatever you need, we're prepared for you. So please, please, please come and join us this coming Friday, May 17th. Big, big thank you to Family Health Center, to you, the beautiful queen, Denise Crawford, our CEO. Y'all see, we got Black women leading. We got our incredible friend, Dr. Khouli. Thank you for your service. Thank you for everything you've done here at Family Health Center. We wish you well on your journey, but we appreciate all that you've done to sustain life here and to help us to thrive here in Kalamazoo, and our illustrious city commissioner. Where are you at, Commish? Y'all know he looked like Albie Shore, right? Thank you so much. We couldn't do what we do without the people that are grounded in this community, all of our partnerships, the relationships that we have to make sure that we get out in this community. Good morning to Marcella. Marcella Cheatman, thank you, thank you, thank you. Make sure you all make sure that you are doing what you need to do to get us where we need to get to. Spread the word, share, like, love, send this to somebody else, get them signed up. Volunteer, join us for the next several weeks, Denise. We're going to be in this community. We're going to be sticking and poking, hugging, loving, dancing, turning up, crunking,
We're
all
gonna
of
take
that.
care of it. That's right. We're gonna
It's
take
a
care of
whole
this
vibe,
community.
right?
Yeah,
That's
east
right.
side.
That's right.
East side. Dr.
Kalamazoo, y'all
Wise.
need to know that the president and CEO of the Family Health Center is a whole vibe, and she's bringing it to the community.
That's right. That's right. We're gonna take care of ours.
Absolutely. We're going to end this broadcast with one more quick video, and then we're going to see you in the streets this afternoon. Friday, Denise, Eric, Dr. Khouli, we will see you at 13 and a half Party Store. Thank you all for your time. We love you all and appreciate your great service. Any parting words you guys got?
Stay healthy.
Absolutely. All right,
It's
you
gonna be
all.
fun.
It's going to be super fun. Like,
Yes.
so Dr. Khouli, it's going to be a day party. It's going to be awesome. You got to come out and show us some of your dance moves.
At 13 and a half. That's gonna be a nice sight to see right there.
Absolutely. We about to shut down Riverview Drive, Eric. It's going down.
We're not calling it a vaccination event, it's a vaccination party.
Absolutely. Don't go to the chicken place or McDonald's or anything. Come over and get our food. We got you. We got you. All right, y'all. We're going to head out here, and thank you all. I'm going to let you folks get back to work. Just give me a quick minute, everybody. We're going to make sure that we share some more important information with you all to make sure that you are totally aware of what's happening in our community. And we're going to bear with me here. Oh, I got it now. Uh-oh, give me 1 minute, y'all. I had a little technical difficulty here. Y'all know I'm not the tech person. I'm trying, though. I'm trying. Hey. Uh-oh, wait a minute.
So hello, we Mothers of Hope are out here in the heart of the community. Make sure that we're giving access and opportunity to residents to be able to get the Moderna vaccine. Since we started this pilot community-based program, we have registered 1,000 individuals who are potentially low income, people of color, so that they can have access to this vaccine to make sure that we have healthy people in our community. Mothers of Hope partnered with the Black Women's Roundtable, with the Advanced Pharmacy Health, to make sure that we were able to come into the neighborhood to get this vaccine to really fight this COVID-19 pandemic. So we have invited people in, we've given them a safe place, we brought in practitioners that look like us, that can help us understand what the risks are and why it is important for people of color, vulnerable people in urban neighborhoods to be vaccinated. And then we brought in some students from Western School of Medicine, Family Health Center, to help make sure that we are getting this vaccine administered in a safe, healthy, quarantine way.
Everyone, so this is Bobby Hopewell, former mayor of Kalamazoo, and this pandemic has been so hard on so many people, on especially people of color, folks that look like you and me. And when I heard the Mothers of Hope was doing this, I wanted to come by and just lend my support. I've got my vaccine, and I'm just so happy that I've been able to be one of those individuals that have taken care of this. Our families need us, our communities need us. This is safe. It is for the health of everybody. We need everyone to get vaccinated. This is serious stuff. My mother has this. She's in the hospital for 6 days. I've had friends that have passed away from this. And we know that this is preventable with this vaccine. So just if you have the time, whether you come to Mothers of Hope in the last few hours that they have here today, or whether you go to another center, whether you call the Family Health Center and get assistance and get in the vaccine, just get the vaccine. It's important, and it's going to save lives, and it may save someone close to you or your life. So let's do it. We can do this.
What it do? It's your boy Galloway. I'm out here at the Mothers of Hope House on 8th Street. I need y'all to come out here and get y'all COVID vaccine. Support the Mothers of Hope and get you a burger. And get y'all grill, sign up, get y'all some free merchandise, all types of stuff, some free masks, all types of stuff. We do this every day. This is day number 2. It's not gonna stop, so might as well come out here and do what it do.
All right, well, we're out here at Mothers of Hope, and I got vaccinated today. I got my Band-Aid on. It takes less than 2 minutes to help protect our community, people of color, the older community, making sure our community can fight back against this terrible disease that's wreaking havoc on our country and our nation. So this is awesome. Thank you to Mothers of Hope and all of our folks, our friends at the Family Health Center for making this happen today.
So we say at Mothers of Hope, it's all good because we do it for the hood. We're looking forward to bringing all that we can to offer all of our friends and families, our brothers, and our sisters here in Kalamazoo, especially on the east side. This coming Friday, May 7th, from 3 p.m. to 6 p.m., we're offering the vaccine. Everything is free. We're barbecuing. We have free laundry detergent, laundry cards. We have swag bags. We have information for you. We're going to have some folks that are going to set up a prayer tent, that if you want some prayer, some hugs, some encouragement, whatever you need, we want to be able to provide that love, that support, that empowerment to help all of us deal with this pandemic, to thrive, to survive, to heal, to be with one another and do everything that we need to do for Kalamazoo, our friends and family and community here. Thank you. A special thank you to Denise Crawford, the CEO of the Family Health Center, to Dr. Khouli there at the Family Health Center, and of course, our very own East Sider, our rider, the Honorable City Commissioner Eric Cunningham, for being with us early this morning and talking about what we can do to help us help each other. Thank you all. Have a wonderful day, and we'll see you all this week, but especially